Thank you, everyone, for being so patient today. We have Shannon Urena here with us. She is employed at the AMG Plastics and Reconstructive Surgery Center. Shannon graduated from Rutgers University School of Health Professionals and has been here at Aultman almost a year. Her specialty focus is plastic and reconstructive surgery, hand surgery, and microsurgery. Shannon will talk a little bit today about Botox and fillers. And welcome, Shannon. We really appreciate you being here.
Thank you so much, Lee. I really appreciate it. I think I've actually been here now for almost 3 years, so
Is
that
it
might be
three
an
years?
older script. Yeah.
So my information's a little outdated. I apologize.
No, don't even feel bad. I was just thinking about that. I'm like, oh, wait a second. I've been here for about three. Oh. I'm ready to start whenever
Yes,
you're
go right ahead. We are ready.
sure. So I know, I guess, a lot of people are wondering about Botox and fillers. A lot of it has been taboo for many, many years. Um, but because of social media and because of what we have out in the news now and Instagram and Facebook, people have gotten more accustomed to it being right in front of them. Um, and what I found is actually now, I'll kind of start out a little bit with about what Botox actually is. So it is a neuromodulator that works at the synapse where your muscle is in, and it's approved for the upper one third of the face. So that would be our angry 11s, kind of like when we frown, when we lift our eyebrows, or our horizontal lines that go across, and our crow's feet. So when we squint our eyes, that's where it's approved for. And yes, there's other people that use it for headaches and things like that, or muscle spasms, and that works well for that. But for this, I'll just keep it close to home. So and I guess it varies too. You're probably wondering, well, how much would I need, or how much would this person need? And I think that really depends on patient to patient. So, somebody who has deeper lines may require a little bit more than someone just starting out. And usually I have my number that I like to start out with. So I'll probably start with a 20 units. And I always say, if you need more, we can always do more. I don't want to inundate the face and do too much. Because there have been situations where people do go to med spas or to places and they get inundated with Botox. So we don't want to, we still want you to have some expression to your face rather than completely with no expression. So, again, everybody's different. Some people use it off label, so I'll talk about that. Some people have put in little aliquots of Botox in their neckline to kind of relax the muscles. Some people have used it for a gummy smile. So when patients, you can actually see their gums when they smile, and you want to relax that muscle up there. Sometimes patients use that for certain reasons. That's really the extent of Botox. Now, in terms of, I'll leave it open to the floor if anybody else has questions about Botox. Lee, would you happen to know if anybody has
Yeah,
questions
if
or?
anyone has questions, please feel free to type it in the chat or unmute and ask anything that you would like pertaining to Botox. Sometimes at the end, they'll think of questions as well.
Sure, sure. Um, so I'll move along to the fillers. So fillers, it is made of hyaluronic acid, which most fillers are that are on the market are made of. There are two major companies in the plastics realm. There's Allergan and there's Galderma. We stay away from anything labeled permanent because you really don't want something permanent in your body. Years and years and years ago, we didn't know much about fillers, and some people were using permanent filler. Um, but this is dissolvable, so you can use it anywhere in your cheeks to kind of help replace volume loss. So as we age, we tend to hollow out and we lose bone mass and we also lose fat. So what do we do to replace that is fill it in. So if you could kind of think of like a shriveled grape. That's terrible to think of, but like a shriveled grape, and you inject some filler and you plump it right back up. So kind of imagine that visualization a little bit. That's kind of the idea with filler. And again, it's hyaluronic acid. Our bodies produce this, it's a sugar in our body. So we naturally make this anyway. Um, some other places to use it is your lips. So if you have lip thinning or lip loss, or you want to kind of create a lip, if you're very, very, very thin, we can do that as well. Sometimes just taking a little bit goes a long way. Um, I would advise against injecting more than one full syringe in one session. We could always do more because that can happen if you have a thin lip and we want to recreate a little bit of a plumper, rejuvenated lip. We can always do that, but I would suggest waiting 2 weeks between each session just so that you can recoup from the swelling, that goes down, and we do it again. Um, some other places we can do are your laugh lines. So, kind of like where you smile and then we get these little laugh lines by our face. We can kind of fix that. There's a special technique too. So, if you've had that wrinkle there, kind of imagine it like a page in a book. It's been there for a little time, especially if we're animating talking. We can kind of not only do we inject in there, but we kind of try to break up the scar tissue. Um, I know that sounds probably a little scary to some people, but you don't feel this at all because one, we put some numb master on you. So that kind of is a topical numbing cream that we use. And we also use something called a beauty bar, which vibrates on the skin and it desensitizes you from any initial poke or any kind of pain. There's also a little bit of lidocaine in the injectable, so you have some numbing already in there. So there's really a wide range. Some people use the filler even for their chins. So some males will want have or protruded chin to add some more masculinity to their chin. And again, we kind of go along the chin line and to protrude the chin a little bit. Obviously, we don't want to do too much. Um, Patients have also used it off label if they've had a dorsal hump, so kind of on their nose where if you can imagine something not as straight. So our dorsum of our nose, there's special measurements that we do. And if you need a little bit injected, of course, we wouldn't use a full um, injected syringe in that area, but sometimes people just want a nicer, straighter line. It's called a liquid rhinoplasty. Um, and a couple other things I think to really kind of hone in on and think about with all of this being said is really knowing who your injector is, knowing that they've had the training to do this or have a medical license, because the facial anatomy, one, is your face. You always want to make sure whoever is injecting you is prepared to do so and knows what they're doing. Um, Pretty much really knowing who you're going to, what you're getting done, and knowing, what to expect afterwards. A lot of the time, patients, after they have these procedures done, really, no working out for 48 hours, because if you increase your heart rate, you increase swelling. So I kind of want all the swelling to come down, and you to heal from that. And of course, ice packs. Some patients use ice packs. What we love is arnica. So it's an herb that's spelled Arnica. You could get it at any vitamin store. And you can find it in an oral pill, or you can get it as like a topical, and you could start using that, I say, before procedures, like on your lips or on your forehead, or even on your face, or obviously ingest it a couple of days before and a couple of days after, and just helps with swelling and bruising, and staying on top of healing time afterwards.